All right, let's talk about something that's probably driven all of us a little crazy at some point. Healthcare costs. Today, we're going to break down a new executive order that's trying to do something about it.
You know that feeling, right? You go to the hospital, you get the care you need, but you're leaving with absolutely no clue what the final bill is going to look like. It's a massive source of stress for, well, pretty much everyone.
So there's this new executive order, number 142221, that says it has a solution. And the whole thing is built on a really simple idea. What if you knew the price of care before you got it? The thinking is that could change, well, everything. So what's actually in this order, and how is it supposed to work? Let's dive in.
Okay, first things first. To really get what this order is trying to do, we've got to understand the problem it's targeting. And it all boils down to one thing: hidden price tags.
Yeah, the executive order actually has a term for it: opaque pricing. I mean, it's pretty much what it sounds like. A system where the real costs for visits, for procedures, for drugs, they're all hidden from us, the people who actually have to pay the bills. And that means you can't shop around, you can't compare prices, you can't even really budget for your own healthcare.
And look, this is language straight from the order itself. It doesn't pull any punches. It says, this whole lack of transparency lets powerful players, like hospitals and insurance companies, operate with, well, insufficient accountability. The order claims that this is what leads to higher costs for the rest of us. But here's the thing. This whole idea of price transparency, it's not exactly new. This latest order is actually building on work that started a few years back.
So according to this new document, the story really kicks off in June 2019. There was another executive order that led to these paradigm-shifting rules, basically forcing hospitals and insurers to post their prices. And based on the analyses the new order points to, the initial results looked pretty good.
Just how good? Well, get this. One analysis from 2023 that's mentioned in the order projected that if these rules were fully implemented, we could see $80 billion in healthcare savings by 2025. That's a huge number. I mean, to put that in perspective, that's more than the entire yearly budget for the Department of Education.
And it doesn't stop there. Another report from 2024, also cited in the order, suggested that employers could cut their healthcare spending by 27%. We're talking across 500 common services just by being able to see the prices.
And this is maybe the most interesting part. What the order claims has been the real-world impact so far. It points to data suggesting that for the most expensive quarter of all services, prices actually started dropping by about 6.3% a year after those first rules kicked in.
So you might be thinking, okay, if things were moving in the right direction, why do we need a new order? Well, this slide gets right to the heart of the document's reasoning. It basically draws a line in the sand, contrasting what it calls the paradigm-shifting actions of the first term with what it describes as a stall in progress since then. The order states that hospitals and plans weren't being held accountable and that enforcement, especially for drug prices, just wasn't happening.
And that brings us right up to today. So let's get into the new executive order and see exactly what it's trying to do now.
Okay, so here are the nuts and bolts. It was signed on February 25th, 2025, and its stated policy is super simple. Put patients first. The goal, as written in the order, is to build on what came before to create a healthcare system that's more competitive, more affordable, and higher quality. But this thing isn't just a mission statement. Nope, it's an action plan. It's got a very specific, time-sensitive to-do list for some major government agencies. So what has to happen now? Well, the clock is ticking. The heads of the Treasury, Labor, and Health and Human Services have 90 days to get moving on 3 key things. Number 1, they need to mandate the disclosure of actual prices, no more estimates. Number 2, they need to standardize all that information so you and I can actually compare apples to apples between different hospitals and plans. And number 3, toughen up enforcement to make sure everyone is playing by the rules and reporting complete, accurate data. Okay, so we've looked at the history, the numbers, the new plan. Let's connect the dots. What does all this actually mean for you? Really, when you boil it all down, this is about shifting power. The whole idea is to take these hidden, totally confusing prices and make them simple and easy to find. The goal is to put you, the patient, in the driver's seat. If you can make informed choices about your care and your budget, the thinking goes, then real competition can kick in and hopefully drive down costs for everybody. Which leaves us with one big question to chew on. Just think about it. If you could shop for a medical procedure the same way you shop for a new TV, knowing the exact cost up front, would that change the choices you make? Would it completely change how you deal with the healthcare system? That is the massive idea at the heart of this whole thing. And it's a question that honestly could affect every single one of us.